Welcome back to Coffee Talk with Mike and Janelle. It is episode 11. We're going to be discussing PTSD and trauma. We're going to start off with the definition of trauma, which is a deeply disturbing or distressing event that someone experiences. Symptoms of trauma would be the inability to sleep, increased anxiety, nightmares, the feelings of guilt and shame or depression, changes in mood, that sort of thing. So many people who experience trauma end up with PTSD, post traumatic stress disorder. Dr. Cummings is going to discuss the criteria for which trauma turns into PTSD.
Yeah. Okay. So, obviously, for the population that Janelle and I treat, trauma affects everyone, but certainly those with ID, DD, ASD, they're at exquisite risk of that, and we're going to talk about that a little bit more next episode. Not everyone who experiences trauma is going to get PTSD.
Right.
There's different levels of vulnerabilities. There's a lot of research about what makes someone vulnerable, what not, different levels of resilience. But a large percentage of people who do experience trauma can develop PTSD. We use that word a lot. It's in movies, it's in television, it's in general conversations. So I just want to be clear because we talk over and over again. Diagnosis is so important for treatment, et cetera, that let's make sure everyone knows what we're talking about when we're talking about PTSD.
Yes.
So for PTSD, first and foremost, just as Janelle said, you have to have an exposure to trauma. But the exposure is not necessarily what people may always think. The most common is direct exposure. You are in a car accident. You are a victim of assault. You are in the middle of a fire. Those kinds of things that are traumatic. And it's actually defined as you really are in a situation that you feel that your life could end or you could have serious bodily harm. But again, what makes different people feel that way varies. So you never want to underestimate how someone
else's experience
to a trauma. Exactly. Regardless of what the actual event is.
Yes.
You can also be a witness to trauma.
Such as domestic violence, children in a situation
Absolutely.
that may not be being physically or emotionally abused themselves, but watching their mother perhaps being abused. Okay.
Exactly. Learning about a very close loved one with an emotional tie who's had a traumatic experience themselves can actually be enough to trigger these events. And then something that we haven't talked about as much in the past, but is so relevant today during the tail end of the COVID pandemic, is something called vicarious trauma. So these are people who are not actually being traumatized themselves, but they're experiencing doses of trauma in other people over and over again on a chronic basis.
So essentially our first line workers, our EMTs, that sort of thing.
Nursing staff in ICUs, police, fire, etc. So you have to have that traumatic event that you've experienced. And then there's a bunch of symptoms that go along with it. Janelle listed many of them out. And there's criteria, but just to keep it brief. Intrusive symptoms. These are nightmares, flashbacks, disturbing thoughts that keep coming back and forth. Avoidance of situations or things that may trigger. So, if you are in a car accident, for instance, avoiding being in a car or at least going on the highway. Things such as that. Changes in thought, changes in mood, and that can present in many different ways. The population that we treat very commonly, kids and people with developmental disabilities, that can often look like psychosis. But it's changes in mood and thoughts, behavior. A hyperarousal, hypervigilance, you'll often see people there. The way we describe it is they're on edge.
Yes.
Right? And you'll hear a noise in the background.
And then you jump through the roof. Yes.
Exactly. So if you have a combination of these symptoms, the event and then the other ones we listed, and you have it for greater than 1 month, that is the definition of PTSD. With all psychiatric diagnoses, you have to have the symptoms. You also have to have a change in your level of function. So you're not doing as well in your job, in your relationships, in your self-care, etc. So that is what PTSD means. Not everyone with trauma gets it, but that's what we mean when we say PTSD.
So essentially, your lifestyle is being impaired over a sustained period of time.
Exactly.
Yes.
Exactly.
So what kind of numbers are we talking about here? Who are folks that have been afflicted with trauma and that are now being affected with PTSD?
So it's surprising. The numbers are sometimes lower than some people think for as much as we talk about, but in some categories of people are much higher than I think people would actually know or believe. So general population, just at any given time, if we're going to measure 1,000 people and measure them in whatever way we wanted to, about 4% of people at any given time will have PTSD. About 3% of kids, about 4% of adults. But it goes much higher depending on other things you're exposed to.
Okay.
Combat veterans, 17 to 20% can have PTSD. There's a lot of talk again because of COVID, first line responders, 20% in some cases, much higher than that, show clinical signs of PTSD. For the population that we treat and things that we've often talked about frequently, parents of children with autism who display severe aggression, 1 in 5 or 20% will have PTSD. That's the same or slightly higher than that of active duty combat vets. And so a lot of times I think people minimize or don't understand what these parents are going through at any given time.
Right.
But again, their stress levels mimic that of people who are in active combat situations. The numbers I think that people don't think about as much are, these are recent studies as well. Adults with ASD or autism, up to 40% have a diagnosis of PTSD. And children with autism, up to 70%. And when you start thinking about exposure to trauma, bullying, emotional and physical abuse, it's a high rate of sexual abuse in this population, but also just being exposed to emergency rooms and police and fire engines and all the things that our families who are struggling with a child with severe autism with aggression experience on a daily level. These are huge inoculums that can result in PTSD in this population, much higher than that of the general population.
And it's really concerning because if you think about the ASD folks, they have high sensory, needs, and a lot of them are not a lot of them, but some of them are nonverbal and may not be able to express.
Well, it's a double whammy, right?
Yes.
Not only are they experiencing trauma at a much higher level, but their ability to process that trauma is often highly impaired. And of course, next episode we'll talk more about treatment of PTSD and other traumatic things. But yeah, it can definitely impede our ability to treat these individuals. And I would argue that, Janelle, I say this all the time, we'll do consults all around the state and all around the country. And certainly we've talked about diagnoses and things like that. But, the most common diagnoses that we talk about in our consults in individuals with IDDD and certainly autism, anxiety, and PTSD is an anxiety disorder.
Absolutely.
Anxiety, post-traumatic stress disorder. Yep. Those are the things that we're ruling out first and foremost in almost every single case that we see, not just of the patients who are identified, but also of the parents.
Yes. So trauma is a huge topic for us. I mean, everybody experiences trauma in one way, shape, form, or another. But I just want to highlight a few statistics that I would like to leave everyone with today. And basically, if you've experienced trauma, you're 4 times more likely to abuse alcohol or drugs, 3 times more likely to miss work or be on medications to address symptoms such as insomnia, anxiety, or depression. And you are 15 times more likely to commit suicide. So trauma is a big deal that we all need to pay attention to, and we don't need to be ashamed. We need to talk about it.
Absolutely. It's a very sobering number of statistics that you just listed. And I guess maybe to finish out, a lot of individuals, a lot of companies, a lot of things will use a term or throw around the term, trauma-informed care. But trauma-informed care really matters, and we'll do an episode about that down the road. But I think right now, given everything that the families that we work with have gone through, it's certainly relevant. But with what's happened across the country and across the world with workplaces and people coming back to work, people really thinking about creating trauma-informed workplaces, and just having that mentality matters more now than maybe ever.
True that. All right, folks, until next time.
APEC out.
APEC out.